All right, Bacho, welcome. Today we are tackling a very important, very fascinating topic from your pharmacology textbook. We're going to unravel the story of a chemical that's, well, it's a true master of multitasking in our bodies. It's a real Jekyll and Hyde, a hero and a villain all at once. So let's get started.
Okay, let's start with a question. Imagine, just one chemical in your body is controlling your gut, your blood vessels, and your headaches. Any guesses who it is? Think about it. Who is this powerful molecule? Well, it is serotonin, or as we should know it, 5-hydroxytryptamine, 5-HT. Please remember that name. So let's get to know this 5-HT a little better. I like to call it the body's complex CEO, and for good reason. Its job is so widespread and, honestly, often very contradictory. It's a powerful chemical messenger, one that can be your best friend or your worst enemy, all depending on where it is and what it's doing. Look at these words, widespread, variable, and contradictory. They really sum up 5-HT perfectly. See, it's not some simple molecule with just one job. No, its effects can change dramatically depending on the situation, and this makes it a tricky but oh so fascinating molecule for us to understand as future doctors. Here's a perfect example of what I mean. How is it even possible that one chemical can squeeze your arteries shut and also relax them to open them up? It seems impossible, right? But the simple answer is, it depends. It all comes down to which blood vessel we're talking about and what state it's already in. This dual nature is what makes 5-HT so incredibly complex. All right, now let's look at some of its most famous actions in the body. I want you to pay close attention here, Butjo, because this is a very, very high-yield area for your exams. You see, if you were to inject 5-HT intravenously into an animal, you don't just see the blood pressure go up or just go down. Oh no, that would be far too simple for our complex CO. Instead, you see something much more interesting. A classic experimental finding known as the triphasic response. That means 3 distinct phases. And this is where you can see its multiple personalities in action. First, there's a sharp fall in blood pressure. That's because it's stimulating nerve endings in the heart. Then, a brief rise as it constricts some of the major blood vessels. And finally, a prolonged fall as it starts dilating the smaller arterioles. So, down, up, and then down again. You must remember that sequence. It's a classic viva voce question. And believe me, it doesn't stop at blood pressure. 5-HT is a super potent stimulator of your gut. A little too much and you'll get diarrhea. It also constricts your airways, though not quite as strongly as histamine. It fires up your sensory nerve endings, which can cause pain or that tingling feeling. And it even helps a little bit with blood clotting. You see, this chemical is everywhere. So, you must be wondering, how does one tiny molecule do all of this? How can it cause constriction here and dilation there? Well, the answer lies in its family of receptors. Think of 5-HT as a master key, and the receptors are all different locks spread throughout the body. Opening a specific lock produces a very specific effect. But Joe, listen to me. Take a mental screenshot of this slide. This is extremely important. Look at the 5-HT1D/1B receptor. Its job is to constrict blood vessels in the head, and the drug that targets it? Sumatriptan, for migraine. Simple. Now look at 5-HT3. It's involved in making you vomit. So the drug that blocks it? Ondansetron, our go-to antiemetic for cancer chemotherapy. You see the pattern? Understand the receptor, and you will understand the drug. And that brings us to the main event of our story today, the connection to migraine. How does this complex, multi-talented molecule, this 5-HT, become a central villain in the painful mystery of a migraine headache? Okay, so there are 2 main theories here. The older vascular theory says it's all about blood vessels in the brain, first constricting, then painfully dilating. The more modern neurogenic theory suggests it all starts with an electrical event in the brain itself. But here's the crucial point. 5-HT is involved in both. It can cause that initial vasoconstriction, and it participates in the painful neurogenic inflammation. It's a key player no matter which theory you look at. So if 5-HT is part of the problem, can we make it part of the solution? And the answer is a big yes. This is the real beauty of pharmacology. We've actually developed drugs that specifically target 5-HT's actions to stop an acute migraine attack right in its tracks. For treating these acute attacks, we have 2 main classes of drugs. You can think of them as the old generation and the new, improved generation. We have the older erga alkaloids and the modern, much smarter triptans. Ergotamine is the classic example of the old guard. Now, notice the key word here, non-selective. This is very important. It doesn't just hit the serotonin receptors, it also messes with adrenergic receptors. It's like using a big hammer. It gets the job done, maybe, but it can cause a lot of collateral damage, and that's why it has so many side effects, like nausea and vomiting. And now, let's meet the new heroes sumatriptan and its family, the triptans. Look at the key word here, selective. These drugs were intelligently designed to be like a sniper's bullet. They only target the 5-HT1D/1B receptors, the exact receptors on the cranial blood vessels involved in migraine. This is a huge, huge pharmacological advancement. So please don't get confused between these two. The simple funda is this: triptans are the smarter, more targeted weapon. Ergotamine is non-selective, has lots of side effects, and is rarely used nowadays. Sumatriptan is highly selective, has fewer side effects, and is now the first-line drug for moderate to severe attacks. It's really as simple as that.
And this shows just how brilliantly modern drug design works. Triptans hit those 5-HT1D/1B receptors. So what does this do? Well, first, it constricts those painfully dilated blood vessels in the head. And second, it stops the release of all those inflammatory chemicals. So it's tackling both the vascular part and the neurogenic part of the migraine problem. It's a very targeted, very elegant solution.
And their clinical importance is, well, it's undeniable. As the quote says, they are the first line of attack for patients who don't respond to simple painkillers. When your paracetamol or ibuprofen is not enough, that's when we bring in the specialist, the triptans. So we end right where we began, serotonin. Is it a friend or is it a foe? You know, in migraine it seems like a foe, but then we use drugs that mimic it to provide relief. In the gut, it helps digestion, but too much of it will cause diarrhea. The real answer is, it's neither. For a doctor, for us, the key is not to label it, but to understand how to control it. And that, my dear students, that is pharmacology.